Fighting for equal justice for those with mental illness are standing side by side those who are fighting for racial justice and gender justice and justice for all those who are marginalized in this country.
I think when we think about Martin Luther King Day, we understand that there are structural and systemic racism in the United States. When we think about the Me Too movement, we understand that what's happening to women is part of structural and systemic discrimination. And when we look at people in the criminal justice system jailed because they are ill, we have to understand that in the context of systemic and structural discrimination that begins very early on.
The evidence that we have so far indicates that without attention to racism that's built into our institutions, our care delivery systems, our criminal justice systems, we're just going to reproduce the same two-tiered system of treatment and response to addiction and mental health that we've had.
When you don't have a father in the home, or you do have abuse, or you send someone to prison and then they come back without being reformed or being transformed or not being cared for as a human being, then society is just repeating the cycle.
I'd love to tell you that this is somewhat of a new and novel type of issue that we as a country are facing, the criminalization of the mentally ill. That's not the truth. It's been this way forever.
Calling attention to the inferior medical care African Americans receive, Dr. King said, of all the forms of inequality, injustice in health is the most shocking and inhuman.
It is shocking how much denial our country still is in, that we could allow so many tragedies of suicide, which we know the things that we can do to interdict and really save people's lives, or in overdoses that we're not doing today. But we don't have the political will and the mandate from government at every level to really get it done the way we would if this were any other public health crisis.
It's important because every week, 10,000 men and women are released from prison who are dealing with complex PTSD. It is one of the most grave injustices that we are dealing with in our country. It is what I call the silent crisis, because I wasn't aware in that moment that my attempt to mask the hurt and pain was really my own way of addressing my trauma, because we don't have therapy available to men and women coming home from prison.
Somehow I thought speaking about my father's death would besmirch his memory. And that was so wrong, because it was that stigma that perhaps kept him from reaching out for the help that he needed. He expected to be there for others, but he didn't want to acknowledge his own struggles.
The challenge is we just have so far to go as a city, and it's just we're in a state of crisis. It's just, for me, the level of fear, not them, but the level of fear that young kids on the South and West Sides have to live with is just absolutely unacceptable. And so for me, this can't be like a 20-year journey. Like, we gotta see, how do we get as a city dramatically safe over the next 3, 4, 5 years?
What we need in the United States is not division. What we need in the United States is not hatred, is not violence and lawlessness, but is love and wisdom and compassion toward one another, feeling of justice toward those who still suffer within our country, whether they be white or whether they be black.
welcome. Welcome to the first of the quarterly spotlight series of the Kennedy Forum. This one on the anniversary of Dr. Martin Luther King's birthday. How appropriate during this really existential moment for our nation in determining whether we're going to live out the full promise of our nation's ideals embodied in our Constitution and articulated most eloquently by Dr. Martin Luther King Jr., that on this, his birthday, we think about the unfinished business of our country, the obligation for us to ensure that all peoples in this country have equal access to the American dream, have equal opportunity, have equal protection. And as we know, Dr. King spelled out that of all forms of injustice in healthcare was perhaps the most shocking. And here we are in the midst of a historic pandemic where Dr. King's words were so prescient. For today, it is the case where Black Americans die 3 times as much as white Americans from COVID. And who could have imagined that that same statistic would almost be absolutely the same as the statistic of the number of Black Americans who die in police custody versus white Americans. It shows that this issue of systemic racism is not just in the criminal justice system, which has given rise to the modern day Black Lives Matter movement, but it is absolutely indicative of a broader systemic racism in all other areas of society. Today, we focus on healthcare, and it is the hope of all of those who have been part of putting this program together that we help to further Dr. King's dream by putting a spotlight on his nightmare that America was not living out the full meaning of its founding documents. And I am so honored that we have so many great participants in today's panel and our great sponsors. And I want to particularly thank Jim for all of his great support over the years. And of course, my great friend and real inspiration behind the Kennedy Forum Illinois, Peter O'Brien. So today, I wish you all a great experience listening to terrific presenters, and I thank Jim for his leadership for all of us in focusing attention on these issues that always need to be front and center in our minds and in our hearts. And with that, I turn it over to you, Jim. Thank you.
Thank you, Patrick. I'm honored to be with you today. I was introduced to Patrick in the important work of the Kennedy Forum several years ago, and I was impressed by their ability to bring together civic, political, and community leaders to address inequity in mental health care. As Patrick noted, the COVID pandemic in this country is disproportionately affecting people of color. Research shows that Black children are more likely than white children to have strong, frequent, or prolonged exposure to major traumatic events. 69% of Black adults with mental health disorders receive no treatment, and 42% of serious mental health disorders received no treatment. So why is this happening? And what can we do to make mental health care just and equitable? That's our discussion today. We thank you for joining us. We begin with a public official who is addressing these challenges, Illinois' 48th Lieutenant Governor, Juliana Stratton.
Hello, I am Lieutenant Governor Juliana Stratton. First of all, thank you, Jim, for that introduction and for moderating this event. And I also want to acknowledge your legacy of excellence in journalism and your commitment to giving back to the community. Thank you, James Burns, for the invitation, and Chair Peter O'Brien for working so hard to plan programs like this that benefit our communities. To former Congressman Patrick Kennedy, thank you for your vision and for creating the Kennedy Forum. We truly need it. We simply have to have space to work to lessen the stigma around mental health issues. To the panelists, Dr. Sarah Vinson from L'Oreal Psych Group, former Secretary of Education Arne Duncan, and Dr. Donald Tyler of Chicago Cred, and Liz Dozier from Chicago Beyond. Thank you for sharing your expertise and giving your energy to this critical work. And to all of the participants, thank you for engaging with us. Good things happen when people come together for a worthy cause. America is a country of both comfort and trauma. The one that you experience the most often depends on your race. If you don't feel safe in your neighborhood, that is trauma. If you don't have enough to eat, that is trauma. If you don't have a place to live, that is trauma. And if you don't have the resources you need to do well in school, that is trauma. If you've been bullied, that is trauma. If you don't have a job, that is trauma. If you are overworked and underpaid, that is trauma. If you've been passed over for a promotion simply because of the color of your skin, then that is trauma. If you have ever been arrested and cannot afford bail, then that is trauma. And if you've done time and you come home and no one will give you a second chance, well, that is trauma. If you saw the George Floyd video, then that is trauma. And if you were angry or confused when there was no justice for Breonna Taylor, then that is trauma. And if you continue the list of those who have lost their lives to police violence and their faces look just like yours or your children's, then that is trauma. If you have heard the so-called leaders in the White House downplay COVID-19 while the majority of people dying are Black and brown, then that is trauma. Trauma is often driven by systemic racism that causes inequities in education, economic opportunities, healthcare, and criminal justice. And if we are ever going to tackle the shocking injustices in mental health care for Black Americans, each of us in our own way, with whatever resources we might have, must fight systemic racism and the trauma it causes. As Lieutenant Governor, my approach to policymaking has been through a restorative justice lens. And what does that mean? Restorative justice focuses on repairing the harm that has been done to individuals one to another, repairing the harm that has been done by systems to communities, as well as the harm that is done by failed policies that have affected residents throughout this country for generations. If there's one thing that I know for sure, it's that hurt people, but also that healed people heal people. We have to talk to each other and support each other. One way to incorporate restorative justice is in the fight for change through our Justice, Equity, and Opportunity Initiative. Early on in our administration, Governor Pritzker signed an executive order establishing the Justice, Equity, and Opportunity Initiative, or what we call the JEO, which is housed in my office. And we are ramping up efforts to change the landscape of what justice really means. As I often say, you cannot have real justice without equity and opportunity. And likewise, there cannot be real equity without justice and equal access to opportunity. What is justice? Well, some hear the words justice and immediately think of policing, jails, and prisons. Well, that is certainly a part of the equation. But justice is not only that. Justice is about affordable housing and healthcare. It's about education and our environment. Justice is about access to healthy foods and pathways to economic opportunity. And yes, justice is about mental health and wellness, and recognizing that with over 400 years of oppression and inequities, that the need to address mental health in the Black community is not only necessary, it is critical for our ultimate survival as a nation. Unfortunately, stigma causes too many from my community to talk about mental health. And for those who find the courage to overcome that stigma, due to systemic racism, too often there are not enough mental health resources to meet the need. And if we are to add the trauma of living in a pandemic and the resulting economic distress, it's no wonder that doctors at Lurie Children's Hospital in Chicago report that they've seen a 50% increase in mental health visits since COVID-19 began. So whatever impacts the Black community at large, our children feel it more deeply. And it is clear that the children in Black communities are by far most at risk because of systemic racism. According to the National Alliance on Mental Illness, only 1 in 3 African American adults who need mental health care receive it. And the Alliance goes on to say that African Americans are less likely to receive consistent care, be included in necessary research, or to seek out mental health professionals. Now that's for the broader community. But just think about how many more barriers exist for those that are in our criminal justice system. Too often, when it comes to Black men, women, and children, we criminalize when the appropriate response should be treatment. And that's why my office is working to expand mental health services for justice-involved individuals. Our JEO partnered with the Illinois Department of Juvenile Justice to develop a pathway for youth to enroll in and receive Medicare benefits upon their release. And as a result of these efforts, the department reported that more than 90% of youth were enrolled to receive health care benefits within 1 month of their release. And as you know, this is critical for continuity of care and to ensure successful reintegration into community. I also convened a health equity working group to improve the quality of life for all Illinoisans in just and equitable ways in light of the COVID-19 pandemic, which again disproportionately impacts communities of color. The Health Equity Working Group convened 25 healthcare professionals of color all across Illinois to explore low or no-cost solutions, points of synergy, and opportunities for collaboration that could improve health outcomes for Black and Latinx communities that have been hit the hardest by this global pandemic. The working group prioritized developing recommendations relating to mental health, including supporting the expansion of telehealth services and collaborating with community partners to address individual and community mental health needs. The recommendations from health professionals of color are created for communities of color by leaders of color, authentic representatives that care deeply about reducing stigma and improving access to care. Now, I'm also proud to chair, or co-chair really, the governor's Opioid Overdose Prevention and Recovery Steering Committee, created by Governor Pritzker through executive order just last year. The steering committee is composed of agency directors, a community representative with lived experience, and representatives of the Opioid Advisory Council that brings together community organizations operating across the state to address substance use disorders. Our work is focused on creating a new state opioid action plan, which will guide state policy over the next 3 years. Stigma around services is a critical consideration as we work to build equity into how we support communities dealing with substance use disorder. Different communities across race, geography, class, and other identities, well, they have different needs and we need to match resources to those specific needs. This is serious work. Opioid overdose deaths increased 3% in 1 year, with 2,167 deaths in 2018 to 2,233 deaths in 2019. And unfortunately, we are seeing the same racial disparities both in overdoses and in deaths. And COVID-19 has only made the situation more dire as we have experienced more physical isolation and the trauma associated with the global pandemic. As a state leader, I am thinking about the intersection of mental health issues and substance use, and I'm committed to reducing stigma around getting the help communities need and deserve. So as I close, I am so excited to hear the ideas and work that is being done as we have conversations today around the work to improve mental health care. In an effort to address the many challenges facing Black, Brown, and Indigenous communities of Illinois, my office and the Kennedy Forum Illinois are partnering on an initiative which will unpack the intersections of mental health and community health. Be on the lookout. We're excited to continue the work. I look forward to working with the Kennedy Forum Illinois and other stakeholders to get this done. And I also look forward to working alongside all of you. Today is a fantastic start. Thank you.
Thank you, Lieutenant Governor Stratton. How do we get here? How do we become a country where 69% of Black adults with mental health disorders receive no treatment and 42% of serious mental health disorders receive no treatment? Our next guest has spent her professional life researching racial injustices in mental health. Dr. Sarah Vinson is a triple board-certified Harvard and Emory-trained physician who specializes in adult, child, and adolescent and forensic psychiatry. Dr. Vinson is in private practice and is an assistant professor at Morehouse School of Medicine and an adjunct faculty member at Emory University School of Medicine. Her new book, which she edited with Dr. Ruth Shim, is called Social Injustice and Mental Health. Dr. Vinson, good to be with you. Thank you for joining us.
Thank you for having me.
In your book, Social Injustice and Mental Health, you state key factors of affordability, availability, and accessibility of mental health care can manifest in disparities by race. What do you mean?
So often the conversation when it comes to race and mental health disparities starts with stigma. It's placing the blame on the group for not seeking out treatment or not being willing to engage with mental health care. But when you look at the structural issues at play, when you ask people why they don't go get help, the number one reason that Black people cite is affordability. So it's not just about people not wanting to get help. It's that our system isn't constructed in a way that it is accessible to everyone. And given what we know about income inequality and wealth gaps in this country, that inaccessibility disproportionately impacts people in the Black community.
How do we make it more accessible?
We have a long list of things to do in order to get it to the ideal place. But we could start with having some form of universal health care that's not dependent on states in the same way that our current system is. There's so much variability in terms of Medicaid, what it will cover, whether you can qualify just based on low income as an adult. We really do need a stronger safety net across the board, and that would be something that would be helpful. But it's not just about having the care in place. You also need care that is culturally and structurally informed. And what I mean by that is if you are giving everyone the same treatment, which sometimes is people's well-meaning goal when they say we want to treat everybody the same, what that usually means in medicine and in most of our systems in America is that you're giving them a system that has been normed and based on the needs of middle-class white people. And so it doesn't translate in the same way, and it may not be as helpful. And so we really need to think about what that person and that individual brings into the room, and also the realities of the different ways society responds to them because of their skin color too.
You also write in the book about racial discrimination and how clinicians diagnose mental health disorders. Can you talk a little bit about that and what that means for the African American community?
Yeah, and I don't want to paint all clinicians in a broad stroke that's negative. But the reality is mental health clinicians are members of American society just like everyone else. They're subject to the same messaging that predisposes people to being biased. And so some of that messaging can make its way into how and how they treat the patients who come into their office. So for instance, we know that there is a broader societal narrative about Black men being dangerous and about Black people not feeling pain in the same way. Well, when that comes into a mental health appointment, that can look like the clinician not really doing a deep dive into that person's own trauma history. It may look like them over-focusing on the person's externalizing behaviors or aggressive behaviors, and not paying attention to things like depression, PTSD, and other things that could be driving behaviors.
Do you think that medical schools and other training grounds for people who practice mental health treatment, do you think they're starting to understand what you're talking about and the need for perhaps some specialized training?
I will say there's more discussion about it now than I have seen before, but it is far from universally accepted in medical schools, in medical school leadership, that this is something that should be an area of focus. What we're seeing a lot of is that the medical students and the residents are actually pushing this. It's coming bottom up rather than top down. And I think that's in no small part because the medical students and the residents are a more diverse group of people than the people who are often in medical school leadership. We're getting better, but we still have a long way to go. And it is far from universally acknowledged in the way that we need it to be in order to really provide care to everyone in the population that is appropriate.
So some of the students are forcing
Absolutely.
change.
The students and the residents really are at the forefront of this. And, the other people that are sort of my career stage are excited. We feel as if we have reinforcements coming when it comes to this battle. And it really is something that is dividing the House of Medicine to a certain extent. How much of a focus should we have on racial issues and gender issues and things like ableism and social justice, and we'll see how it pans out.
You also write that treating clients should include cultural humility. What do you mean by that?
So part of what was happening in medicine for a long time, and still is to some degree, was a well-intentioned effort to understand things about certain groups so that you could better serve them. What happens, though, sometimes with that approach, the cultural competency approach, is that people can get clumped into these buckets and they're painted in very broad strokes that sort of flatten out who they are or what they believe. So one of the examples I like to give is if you have a Black boy who grows up in the Mississippi Delta versus one who grows up in inner city Chicago versus one who grows up in PG County in Maryland, those are very different lived experiences, even though they're all Black boys. So some cultural competency thing that says Black people do this isn't really going to be helpful. You really have to look at them in a broader context. And so with cultural humility, what we're trying to get clinicians to do is move away from, I know all these things about Black people because I went to a cultural competency class, to asking people, what does your racial identity mean to you? How does that affect how you see yourself in the world or what your experiences are? So rather than taking a stance of, I know these things, really being curious about the patient's perspective and welcoming that into the encounter.
In other words, understanding what you don't know and doing some work to understand.
And not generalizing. One of the things that I remember talking to some of my teachers in residency about was, again, the well-intentioned things that people say, like, I think everybody's really, really alike and everybody should be treated the same. And I told them, when I hear that, what I actually think you're saying is everybody should be treated like white people. Because if you haven't taken the time or made the effort to understand a minority perspective, It's not one that you know. People of color, especially those who advance professionally, have to understand the predominant culture. Otherwise, you can't advance professionally. But you can be highly educated, have all kinds of degrees, and never really have sat in the seat of someone who's in a marginalized population in a way that allows you to understand their thoughts, feelings, and behaviors.
Dr. Vincent, what strategies do you think we need to achieve justice and equity in mental health care?
So one of the things that we have to do is just start counting. I'm always surprised when I talk to healthcare systems or leaders and I ask questions like, what are the patient satisfaction scores of your Black or Brown or Indigenous patients versus your white patients? They don't know. What is your retention rate of your clinicians of color versus your white clinicians? They don't know. And so we really do need to have some ways of measuring because we often manage what we measure, right? And so being really concrete, it's not enough to have cultural competency day and go to some lectures if you're still operating the same way. And what we know about human behavior, what we know about adult learning is that it's not just about receiving the information. The information is necessary, but it's not sufficient. There has to be action that follows it. And we need metrics to hold us accountable for that action and to see if that action is working. And then over time to change it if it's not, and to keep doing it if it is, so that we can actually move from not just awareness to action and equity.
We want to tell our audience that if you are interested in Dr. Vincent's book, we have a link in the comments section, so you can get a hold of that. It is a fascinating read. Dr. Vincent, thank you so much for your time.
Thank you for having me.
We're joined now by Arnie Duncan and Dr. Donald Tyler, or as we call him, Dr. T. Arnie Duncan is an American educator and served as United States Secretary of Education in the administration of President Barack Obama. He is now the founder and managing partner of Chicago CRED. Dr. Donald Tyler is Director of Clinical Services for Chicago CRED, providing a variety of mental health services, including help for young people at high risk of involvement in gun violence. Secretary Duncan, Dr. T, thank you for joining us. Good to be with you. Secretary Duncan, you have devoted your life to education and violence prevention. Why is it important to address mental health, specifically trauma, to achieve positive outcomes?
Well, as we're trying to reduce violence across the city, and specifically on the south and west sides, it produces the vast majority of violence in our city, unfortunately, Jim. The only way I know how to do that is to help people heal from their past trauma. We have a saying that hurt people, but people who are healed can help others heal. And if you are reliving that trauma every single day, if you're stuck in that mentality, you're going to do things that you wouldn't do if you were in a better place. So we have 5 pillars to our work, but I can make a pretty compelling case that what Dr. T and his team does, that clinical support, is, may arguably be the most important pillar of our entire work. If you want men to transform their lives, if you want them to be positive role models, you have to have them heal. And let me be clear, this is not post-traumatic stress disorder. This is not post-anything. This is present, this is current, it's ongoing, and it's often been a lifetime of trauma.
Dr. T, you say on your website that we reject the notion that Chicago CRED provides a second chance. For many of the young people in Chicago, CRED is their first chance. What do you mean by that?
Well, a lot of the young men as well as young women that we work with, they start life off with incredible amounts of disadvantage, really in many ways, right? And, most of them come from families that have experienced incredible amounts of chronic stress and trauma for multiple generations. So if you think about the families that, in the neighborhoods where there are high levels of violence, right? We're talking really, first of all, about, poverty for generations, right? We're talking about, decades of discriminatory practices, that have left them locked in poverty in these neighborhoods, really, again, for multiple generations, right? And so we're talking about families that have been overwhelmed by massive amounts of stress and traumatic events. And so most of our young people were started off their life in families that were really overwhelmed by all of these types of things, right? And so many of them had early life experiences, with violence within the home, drug and alcohol dependence, difficulties in terms of health challenges, all sorts of things of this type of nature. Family members who have been incarcerated, and so not to mention the things going on in the neighborhood in terms of violence occurring in the streets, right? And as I think about it, research that I did for my dissertation, I looked at the extent to which parents have been exposed to violence as well as their adolescent children, right? And so one of the things I found was that those parents had just as much exposure to violence as their adolescent children had, right? And so parents are dealing with all of these types of things, from, depression, traumatic stress, other mental health problems, right? Oftentimes the young people that we work with, they experienced abuse and neglect, as children, right? And so they had all of these disadvantages from the very start. And so when we say they haven't had a first chance this is what we're talking about, right? And so this is their first opportunity to really get the type of support, direction, assistance, resources that they need to really be able to thrive and reach success.
Secretary Duncan, why do you think society and people in positions of power have been so slow to recognize this?
Well, that's the $1 million question, Jim. And I think we're learning hard lessons every single day. I do think the general public, maybe particularly here in Chicago, has been a little bit paralyzed by this issue. I don't know if they felt helpless or hopeless, as there's nothing you could do. And I can just say that watching our young men, and transformation is not overnight, it's not linear. We have great days and we have heartbreaking days. But to see what our young men can do when they have folks like Dr. T and his team to talk with, to see how life transforming that is, to see them gain those skills. As much as we're doing, I promise you we're not doing enough. I think at the end of the day, Jim, the real question is, do we believe that these young men and women, that they can be redeemed, that redemption is possible, that transformation is possible? I think it's much easier to write off populations and write off black folk or poor black folk or whatever. It's a very different thing to say that they can be tremendous assets, and in fact, they're the ones that are going to lead Chicago to a safer place. And if we decide that they are assets rather than liabilities, then we have to figure out what resources they need to be successful, and those clinical supports that working through that trauma has to again be at the top of the list.
Dr. T, I wonder if you can give us an example of someone you have been able to reach, someone who had experienced a lot of trauma, was heading down the wrong path, and they have a much different life today because of the work that you're doing.
Oh, absolutely. So we've had some really strong success stories, and I'll speak a little bit about just the first person that comes to mind. And really, as we're thinking about not having had a first chance, this person really is an example of that. This young man, and as I can't remember his exact age at this point, but it was somewhere like 10 or 11 or 12 years old. Conflict going on within the family, and he was put out on the street. Right, put out of the house. And from that young age, really until the time we started working with him in his 20s, he hadn't gone back home. He hadn't lived with any family members. So it was a matter of couch surfing with friends. Sometimes it was living in a dope house. Sometimes it was being on the street from that young age until his 20s. Okay. Very strong bond, with his homies, right? They're his family, right? But they're involved in violence, right? And it's warfare every day, right? So he's living with them, right? Involved in conflict on a regular basis, right? Not much attachment to school, and so didn't get his high school diploma, left school at some point early, exposure to a great deal of violence. Shot himself a couple of times, lost several friends killed in the streets, right? And this is a typical type of story, right? And so, but once we got involved, right, and I worked with him myself, had developed strong relationships with several of the staff, including the person who was his life coach, right? And really began to make this transition, right? Began to see a different way out, right? And so he became one of our early success stories in terms of finding employment and keeping employment, right? And he really was able to turn himself around. He had to change those relationships. He had to see himself in a different way. He had to get the assistance he needed. He had a serious dependence upon drugs, right? We helped him conquer that problem, right? And he became one of our early successes. He still had struggles, right? And so it's never like an even pathway up, right? So it's bumps along the way. And so sometimes 2 steps forward, 1 or 3 steps back, right? But we stayed committed and involved, and he stayed connected with his with us, and he found success. And he's still working at it, though. Not easy.
You stayed committed, and it's much more than theory, isn't it? It's practice. It's action.
Absolutely.
Dr. T, you talk a lot about fight versus flight response. How does this play into what you're doing?
Right. And so as Arnie spoke to, and as I spoke to some as well, and, we really have to understand these young people in terms of really these experiences that they have on a daily basis. Right. And so, it's very akin to people who are soldiers, right, in the military, or people who live in other areas of the world that are war torn, right, where there's civil war or political violence, right? You have to think about being constantly exposed to gun violence on a daily basis and how that impacts a person, right? But you also have to think about everything that happened even before it, and the things that I was describing earlier in terms of how they start life and all of this trauma and all of the chronic stress over the course of their life, right? So when you think about all of those experiences, it conditions the central nervous system, right? It conditions and changes the brain and how it functions, how the stress response operates. It's changed over time as a result of all of these traumatic and stressful experiences, right? And so these persons become primed, right, for self-defense, right, in response to the slightest hint of a threat, and threats of all different forms, right? And so there's this type of impact, right, where sometimes they become kind of locked into survival mode, right, because of this conditioning over many years and all of these different traumatic and stressful events.
Secretary Duncan, you were a secretary, a head of a United States department. You had all sorts of professional options, no doubt. You came back here to do this work. Why?
Well, Chicago's home, Jim, and all the opportunities I've had throughout my life, educationally, socially, culturally, athletically, I really owe to the city and to mentors and to friends who helped take care of me. And unfortunately, Jim, I started losing some friends to gun violence when I was a teenager. So that stuff, I think, shapes you and, frankly, probably scars you in some ways, a little bit tough to talk about. And during my time leading the Chicago public schools, very tragically, there's a lot I'm proud of, but very tragically, during those 7.5 years, on average, we had a student killed every 2 weeks due to gun violence here in Chicago. It was a staggering rate of loss. So this, to me, felt like the crisis facing the city. Didn't feel it was being addressed. There's no reason Chicago should be six times more violent than New York, 3 to 4 times more violent than LA. It's not fair to anyone, but it's especially not fair to our children on the south and west sides where this is their daily reality. They shouldn't have to grow up with that fear and trauma. So for me to try and come home and help out and get back a little bit, this felt like the biggest need, the biggest challenge, and frankly, the biggest opportunity.
I sadly have to cover a lot of violence, and people who consume news see the violent headlines and the tragic stories of young people who lose their lives. As we wrap up this interview, I would ask both of you to give us reason to be hopeful.
Where my hope comes from is really just getting to know these young people, right? And you have to get to know them and to really understand. People just seeing the headlines, right? The terrible headlines, right? People don't really understand what's happening, right? But when you get involved in these young people's lives, then you get a better understanding, right? And you get to understand them. And so my hope comes from them because none of them really want to be in this situation. They're not, no one would really choose this, right? A lot of times they feel like they don't have a choice but to fight these wars. And these are wars, right? They're not sanctioned by any government or but they're just as real, right, as the wars that are sanctioned by governments, okay? And so, right, they wouldn't choose this, they wouldn't, right? But they don't feel like they have a way out. So my hopefulness is understanding that they don't really want to be in this situation, and they just need someone and something to help them out of the situation and help change these circumstances, and that's what we're doing.
I'll try and answer that at two levels. As Dr. T said, we have literally hundreds of men. When everyone has a unique story, but just stories of amazing courage and resilience and leadership. We have guys on our team now who started as participants, who were able to broker a gang truce, stop the shooting that had been going on forever. Lots of bodies on both sides, and they're now mentoring the younger generation. So we know transformation is possible. That's at the street, at the human level. That's the most important level that Dr. T talked about. A little bit higher level, Jim, in a really tough year in terms of violence, the neighborhood we've worked the hardest and the longest out south in Roseland. Roseland was significantly less violent than the rest of the city. And there's no one easy answer, but the fact that we've been there for 4 years, the fact that we've worked with so many men, the fact that we've put in place a number of non-aggression agreements and peace treaties, we know what's possible. And so in a really dark time, it may sound contradictory, but it's not. In a really difficult time, of a horrific year in terms of violence, I've honestly never been more hopeful. And if we can scale, and if we can work in these, it's not 50 neighborhoods, Jim, it's 15. If we as a city can't commit to 15 neighborhoods to doing what it takes to work with enough men, if we have the courage to do that, I promise you, 3, 4, 5 years from now, we'll be in a radically different place.
Dr. T, Secretary Duncan, thank you for joining us.
Thanks for the opportunity.
Liz Dozier has spent her career working to disrupt the culture of inequity in urban neighborhoods. In 2016, she started Chicago Beyond, which has invested more than $30 million in 14 local nonprofit organizations in an effort to help young people reach their fullest potential. Liz Dozier is a former principal of Finger High School and was featured prominently in the CNN docuseries Chicagoland, which showed her devotion to young people. She knows firsthand how trauma outside the classroom hurts students. Liz Dozier, thank you for joining us.
Thanks so much for having me, Jim.
Why is mental health so foundational in your work at Finger High School and your work now at Chicago Beyond?
Well, I think mental health is foundational across the board, whether you are, working at Finger High School or here at Chicago Beyond or just a human being. Mental health is absolutely critical. It's the foundation for living a happy, healthy, whole life. It's not particular to any entity. And honestly, I think that we should all be interested in mental health and wellness at all times. I think that COVID-19 is really revealing for all of us, maybe some who didn't take mental health and wellness as seriously as we needed to, how critical it is to our day-to-day functioning, the ability to be able to, connect with one another, and now not necessarily connect with one another in the same way takes its own toll. And so I truly believe that all of us need to be especially interested in mental health and wellness as we think about, again, living happy, healthy, and whole lives.
Many of us got to know you when you were the principal of Finger through the CNN Chicagoland docuseries. You were, many would say, the star of that series. I wonder how you approached good mental health among your students when you were the principal there. When you knew that a student had suffered some trauma, how did you approach that student and what did you do?
So when we were at Finger High School, when I was the principal there, we really centered mental health. I mean, our students can't even begin to engage in the curriculum or in after-school activities if they don't have a solid mental health foundation. And so for us, that meant introducing things like grief counseling into the course of the day, or individual opportunities for counseling, really focusing on students' psychological well-being. But we know that it's not just important for our young people, but it's important for adults as well. We know that 1 in 5 adults in the U.S. experiences a mental health condition, but less than half of us actually receive treatment, and that point really becomes even more stark when we think about those on the farthest rungs of society who lack access to mental health and wellness services and resources. And so the organization that I lead now, Chicago Beyond, like Finger, we are interested in holistic healing and in building a strong foundation and supporting a strong foundation for people and addressing everything from trauma to mental health issues that exist in our society as a whole.
What do you know now that you did not know about mental health at the beginning of your career?
That's a great question. Growing up, like many folks in my community, we didn't focus on mental health and wellness. There were traumatic experiences that happened or grief that occurred, and it was kind of, pull yourselves up by your bootstraps. Or in my community, which was primarily Black, it was we're gonna pray about this and we're gonna give it to God. And it wasn't until I really became a teacher, I left home, became a teacher and ultimately a principal, that, I understood the importance of mental health for our students, but also for our teachers. And it's when I really understood how critical mental health was to being able to engage fully in life. Many of our young people at Finger High School, were facing enormous odds and were up against extreme traumas. And for us as a school to not address that wouldn't allow the young people to show up and be successful. And so mental health became a cornerstone of our school. Similarly to the work that we're doing now at Chicago Beyond, it really is about healing, about holistic healing, about investing in organizations that center mental health and wellness.
You have talked about systemic racism and the impact that it has on the mental health of African Americans. I wonder if you could talk to our audience about that.
There is a great quote, and I don't know if you've seen it. It came out of an op-ed article that Kareem Abdul-Jabbar wrote in the LA Times, and he was so eloquent in the way that he wrote about racism, and he talked about how it's like dust in the air. You can't see it, but it's literally it's everywhere. And it's not until you actually, open the curtain or the blinds and shine light in that you realize this dust is everywhere. And it's very similar to racism in our country, to systemic racism. It has infiltrated every facet of our society, from the healthcare system to the education system to, how people get housing and loans. And it just has infiltrated every aspect of society. And, when we think about, racism infiltrating every aspect of society, along with that, it has impacts on, I would argue, not just Black people, but all people. We all don't do as well and live up to our highest potential when we are in a system that is essentially rigged against Black people. And so, when I think about racial trauma, and when I think about, being a part of that system, it is, I think, incredibly traumatizing for the individual who is experiencing it, but also for everybody who is wrapped up in that system.
We have many people in our audience who are in the mental health field, mental health professionals, but there are any number of folks we know are watching who are not mental health professionals, but they want to be of service. What would your message be to them?
I think that we all need to, when we think about mental health and wellness, particularly at this time, we think about, racism and the intersectionality of all of what's happening in the world. There are a few things that I would highlight to say we need to lean into as individuals. So I think one is just educating ourselves and helping so we can then help to educate others. We need to be reading more, understanding more about our nation's history to understand what's happening today and the effects that it has. We have toolkits online at chicagobeyond.org, anti-racist toolkits where people can learn the effects of racism and what it's done, but also the exciting part of like how we can all, I think, collectively do better together. The other thing that's, I think, really important is that we need to become more comfortable with being uncomfortable, if that makes sense. I think that as a society, we've removed ourselves in some ways and put ourselves almost into this neutral ground of, I would call it like silence and inaction, whether it comes to issues again of like race or mental health. We've just kind of gone silent, and I think there's an incredible opportunity for us to lean in, especially during this moment. There's a great quote by James Baldwin, and he said, that we live in an age really when silence is not only criminal, but it's suicidal. And I think when we are silent, whether it's on issues of race and racism, or whether it's on issues of mental health and wellness, or how our brothers and sisters across the country are being affected in different ways, like ultimately it's suicide, I think, for all of us. And so I think leaning into our own understanding so that we can help others, as well as being comfortable with being uncomfortable and exploring is critically important.
Liz Dozier, thank you so much for joining us, and all the best to you and your work with Chicago Beyond.
Thank you so much.
Thank you for spending an hour of your afternoon with us today. Our goal with this program was not to give you all the answers. In fact, it was meant to encourage you to ask more questions and give you the motivation to provide equity in treatment and support for Black Americans living with mental health or substance use disorders. In the following day, the Kennedy Forum will be following up with you and providing resources and information on how you can stay engaged. We want to thank again Lieutenant Governor Juliana Stratton, Dr. Sarah Vinson, Secretary Arnie Duncan, Dr. Donald Tyler, and Liz Dozier for offering their time and insights. We also want to thank the Kennedy Forum for having these conversations. It honors the legacy of Dr. Martin Luther King Jr.
Thanks so much, Jim. What an impactful and important program. I want to thank Patrick Kennedy and all of the board members of the Kennedy Forum Illinois for your leadership in producing this event and our future events. I also want to thank all of the sponsors who made this program happen. We couldn't do it without you. Most of all, I want to take this time to thank all of our speakers today. Jim Williams, you have been a longtime friend of the Kennedy Forum, and I am grateful for you. Lieutenant Governor Stratton, a big thanks to you and Governor Pritzker for prioritizing mental health in your policies and funding. Secretary Duncan and Liz Dozier, thank you for helping us to start this conversation back in 2018 to continue it today. Dr. Tyler and Dr. Vinson, thank you for bringing cultural humility to the spotlight for treating those living with mental health and substance use disorders. As we reflect on today's conversation, I want to challenge all of us to recognize our privilege. Our privileges come with immense responsibility to our community. Each of us must pick up this mantle if we are to realize justice in all things, including healthcare. I also challenge us to recognize and embrace our humanity. Like Dr. King said, injustice in health is the most shocking and the most inhuman. We must make change in our communities and systems and reject the status quo that is resulting in the senseless deaths of our Black community members. This conversation is just beginning our journey together. The Kennedy Forum sees you as a partner for moving this vision forward throughout 2021 and beyond. We will continue to provide opportunities like this, as well as opportunities for you to engage in dialogue. Watch your email inboxes for more information. Thank you for your participation today and commitment to justice.